This is Dr. Jim Whiting, and I would like to welcome you to Maine Medical Partners Surgery. The following video is a patient education video surrounding hemodialysis access and specifically talking about AV fistulas for hemodialysis access. Now, some of you may be asking, why do I even need a surgeon in order to do dialysis? It's a good question. The answer is that good dialysis requires removing half a quart of blood every minute, and it's washed by the dialyzer and put back in your body. Half a quart a minute. That's a lot of blood, and there are only a couple of ways of accomplishing this. The best ways all require surgery.
Worldwide, there is complete agreement. A fistula is the best way to accomplish dialysis, and a fistula needs to be created surgically. Well, what exactly is a fistula? Now, there are a number of different names for fistula, and there are different variations on a theme, but the basic idea behind a fistula is the same for all of them. In your arm, you have arteries, and arteries carry blood from your heart down to your hand. They carry that blood at high pressure and high flow. If you could put a needle directly in the artery, that's all you would need to do, because you could get plenty of blood out of the artery for dialysis and have plenty left over for your hand. But you can't. These arteries are buried deep in the arm, and they're very difficult to hit with a needle. Veins, on the other hand, are much more accessible. That's why we use them for blood draws and intravenous lines. Veins bring blood back away from the hand, back to the heart. The problem with a vein is that no one vein carries enough blood to be able to do dialysis. A fistula is a way of giving you the accessibility of a vein and the flow of an artery. We essentially create a detour, or a short circuit for blood that's heading down from your heart to your hand. In this slide, the bottom represents your heart, and the top represents your hand. We find a vein, and we divide it. We tie off the end nearest your hand. Then we take the other end, and we sew it onto a hole that we've made into the side of the artery. Blood that's coming down your arm can go around and detour into this vein, or blood going down your arm can continue and go to supply your hand. In any case, over time, the excess blood that's going into the vein will cause that vein to grow larger and tougher. Now, sometimes as that vein grows, the vein can become quite large and unsightly. Other times, it's much more subtle, and the fistula really doesn't stand out much at all. Either type of fistula can be excellent for dialysis. In any case, once you have a functional fistula, and it can often take up to 2 or 3 months after creation of the fistula for it to be big enough and tough enough to accept dialysis needles. You go to dialysis, and 2 needles will be placed each time. One needle, as shown in the left diagram, draws blood off. The blood goes through the dialyzer, and then another needle returns the blood back to your system. You'll sit at a chair, and the blood will flow out of you into the dialyzers and then back into you, as you see on the diagram on the right. Well, I said earlier that a fistula was the best form of access. Why is this? Why is a fistula best? Well, there are a number of different reasons. First of all, it's fairly easy to create. Yes, it is surgery, but it's a type of surgery that we do frequently. It's day surgery, so you'll go home the same day. It only takes about 45 minutes to an hour to complete the surgery, and it really isn't very painful, although you will receive a prescription for narcotic pain medication. A lot of patients never even fill that prescription and just use Tylenol. Another good reason why a fistula is best is that it gives you good dialysis. We know that patients who get good dialysis feel better, they have fewer problems, and they even live longer. This is probably the best reason for using a fistula as opposed to other forms of access. It has a number of other advantages as well. It's low maintenance. You don't really need to do anything to take care of it. You don't need any special dressings. The only thing you need to do is make sure people don't try and draw blood from the fistula arm or use it for blood pressures. There's nothing artificial. It's all your own tissue, and as a result it's very resistant to infection. It'll last for many years if properly taken care of and give you good dialysis. There's nothing that hangs out of the arm. Everything is, as I said earlier, underneath the skin. You can use the arm normally, and there's no special care other than, as we said, to avoid some procedures. Well, there are pros and cons to every medical procedure, and a fistula is no exception to that rule. What are the drawbacks to a fistula? First of all, it's surgery, and there are possible complications, as there are with any type of surgery. There can be bleeding. After all, you're putting two blood vessels together. Now, a little bit of oozing, something to wet the dressing, or hematoma, those are not uncommon. Significant transfusion-requiring bleeding, that's vanishingly rare. We're talking about a very small incision, generally only an inch or two, and we're talking about working only a half an inch or so below the surface of the skin. Clotting, however, is a much bigger problem. Roughly 25% of fistulas will be lost to early clotting. This isn't dangerous. You don't have to do anything about the clots. But usually, once a fistula has clotted, if it's clotted in the early postoperative period, that means a loss of the fistula, and you have to look at some other site or some other way of doing access. In fact, we lose approximately 20 to 25% of all fistulas from this problem. Lastly, something called Steele syndrome. Basically, blood is being stolen from your hand. Too much blood in the fistula, not enough to your hand. It should also be mentioned that it's not uncommon to need subsequent procedures after placement of the fistula in order to get the fistula ready to be used for dialysis. There are a couple of other drawbacks to a fistula as well. It takes up to 2 to 3 months for a fistula to be ready to be used. That process of it getting larger and getting tougher doesn't happen overnight. And if you need dialysis before it's ready, you'll have to get a catheter. So there is a longer lead time to a fistula, which makes it more difficult to predict exactly when we should be putting it in.
Okay, now that we've gone over the basics of a fistula, where do we go from here? Well, first you will see your surgeon, and he or she will discuss the specifics of your case with you. After that, the next steps will be arranged. Sometimes that might mean further testing, or it could even mean postponement till a later date. Sometimes that would mean a visit with anesthesia, and other times that might mean going right to arranging surgery. We do have some other information in terms of videos that cover preoperative and postoperative instructions, as well as alternatives to fistulas if for some reason your anatomy determines that you're not really a good candidate for a fistula. But for now, we thank you for listening, and we'll be with you to discuss this with you soon.